This knowledge bite is about local anaesthetic. You have short-acting and long-acting. Examples of short-acting are lidocaine and xylocaine. Examples of long-acting are bupivacaine and chiricaine. We need to be able to calculate the maximum dose of anaesthetic. Lidocaine is 3 mg per kilogram, 7 mg per kilogram if you add adrenaline. Bupivacaine has a maximum of 2 mg per kilogram due to the cardiotoxicity risk. Anaesthetic typically comes as a percentage, such as lidocaine 1%, lidocaine 2%. We need to be able to convert this into a volume. To do this, we multiply the percentage by 10 mg per ml. Let's take lidocaine 2% and a 70 kg female patient. 2% is equivalent to 20 mg per ml. If the maximum dose is 3 mg per kilogram for lidocaine, the maximum we can give is 210 mg total. Therefore, the maximum volume available for use in this patient is 210 over 20 mg. This gives us 20.5, and the unit of measurement is mils. We can increase the volume by diluting it in saline.